Hello, everyone. Thank you for joining us for today's webinar, Multidisciplinary Responses to Complex Homicide Cases. Before we get started, I'd like to note a few housekeeping items for anyone who is new to the Zoom platform. The chat box can be used to send messages to the entire group, the presenters, or our IT coordinators if you are having any technical issues. At the bottom of your screen, you will see a Q&A box. Please click on it and type any questions for the presenters there, and we will address them at the end of the webinar. We will be sending around an email after the webinar with a link to the recording, a PDF of the slides, and a brief short survey. My name is Josue Melendez. I'm the program manager for the Complex Homicide Program here at the National Center for Victims of Crime. Today, I'm presenting with my colleague, Laura Cook.
Hey everyone, my name is Laura. I am the Director of Training and Technical Assistance with the National Center. And in that role, I'm also the Director of the Complex Homicide Program.
So today's webinar is brought to you by the National Center for Victims of Crime and in partnership with the Department of Justice, Office for Victims of Crime. However, the information is provided by the National Center and does not necessarily represent the official position or policies of the U.S. Department of Justice. So today we are going to start by providing you with some background on the Complex Homicide Project. We are going to spend most of our time conducting a walkthrough of our new Training and Technical Assistance website, which is ncvctta.org, and highlighting the resources on that website that were produced during the Complex Homicide Project. We will address any questions from the audience at the end of the webinar, so please use the Q&A box. Thank you. So our project vision is as follows. As we all know, losing a loved one to homicide can impact family, friends, and the community in a tremendous way. They are left behind with having to cope and grieve, and may need services to get through this very difficult time. The need for the survivors can vary and may not all be addressed at the time of the homicide. During this project, we wanted to make sure to provide comprehensive services for the family and community to help them get through losing a loved one and the long-term aftermath effects of that. Throughout the project, we wanted to identify promising victim-centered and trauma-informed responses, as well as evidence-based practices that multidisciplinary teams can utilize when responding to complex homicide cases. This will help address the needs for survivors of homicide and enhance the multidisciplinary response within the first 24 to 48 hours following a homicide. The complex homicide cases under this project that we addressed were gang-related homicide in which a gang was involved, intrafamilial homicide, any homicide committed within the family setting. Child witness of homicide is when a child was present and witnessed a homicide, and DUI, driving impaired homicide, where an intoxicated individual killed someone while driving. During the project, the National Center was the training and technical assistance provider to 7 demonstration sites throughout the United States. We will go over the sites in a little bit in the next slide. These sites worked on developing and implementing a multidisciplinary response to the complex homicide needs that was victim-centered and trauma-informed. They worked with other members of their multidisciplinary team to effectively respond to the wide-ranging needs of families. The National Center also worked with the sub-grantee, which is the National Sheriff's Association. They assisted us in providing training and technical assistance to the sites as well, particularly in trainings provided by and for law enforcement. We want to give a huge shout out and thank you to Jessica Vanderpool, Tony Larimore, Christy Barksdale, and Chelsea Ryder, who have been a great help and assistance on this project from the start. We thank you. As mentioned before, we worked with 7 different cities throughout the United States that focused on response to complex homicide cases. 2 of our sites that dealt with intrafamilial homicide were the Anti-Violence Partnership of Philadelphia, located in Pennsylvania, and the Medical University of South Carolina, located in Charleston, South Carolina. Their multidisciplinary team is called Charleston Heart, which is Homicide Early Intervention and Advocacy Response Team. 2 of our sites focus on gang-related homicides, and those were Chicago survivors located in Chicago, Illinois, and the Bronx County District Attorney's Office located in the state of New York. Two of our other sites focus on child witness to homicide, and they were the Baltimore Child Abuse Center in Baltimore, Maryland, and Frontline Service, which is a mental health agency in Cleveland, Ohio. And one of our sites focused on driving impaired DUI homicide, and that was the County of Palm Beach Division of Victim Services in Palm Beach, Florida. A little statistics about our training and technical assistance that we provided. Over the past 4 years, we provided training and technical assistance to the demonstration sites, which were all the 7 sites just mentioned. During this project, our training was mostly comprised of live training seminars, which are in person, webinars online virtually, mini summits, and grantee meetings. During our mini summits, we brought staff from 2 sites together to share best practices that they utilize and discuss challenges. We had 3 grantee meetings, which we'll talk about more detail later in this presentation, where staff from all sites attended to share their progress and receive additional training. Some of our statistics from the training that we provided training was that we provided training to more than 1,500 attendees, and the number of training we provided were 60. And the National Center worked with over 50 subject matter experts to help provide training and technical assistance to the demonstration sites. And now we're going to go over our training and technical assistance portal, and I will hand it over to Laura.
Awesome. Thank you so much, Sway. So like Sway said, we're going to move into a walkthrough of the website here. What you'll see, the screenshot on the PowerPoint here is our homepage, and the URL is over here on the right. Like Sway said, it is www.ncvctta.org. So let's go to our site now. And here's our homepage. Right now, most of the resources on this page are focused on 2 of our projects, the Complex Homicide Project and also Project Safe Neighborhoods. In the future, we hope to do more training and technical assistance on a wider range of topics, and we will plan to add more programs and projects that deal with training and technical assistance to this site. One of the projects is our Financial Crime Resource Center. That's another program that I work on at NCVC, and I hope to get materials about financial fraud and how to help victims of financial crime up on this website in the near future. As you scroll down through the site, you'll see some statistics on victimization, followed by a link to a survey to evaluate your TTA needs. The survey was created through Project Safe Neighborhoods, but it can be used by anybody who is interested in kind of doing a short evaluation of training and technical assistance needs. Then further down the page are our blog posts. We post a few times per month on various topics, anything from human trafficking, which has been lots of news on lately, to common scams related to the coronavirus pandemic. And as you'll see, we also post about new resources. So our promising practices report that I'm going to talk about here in a little bit, new resources that we put out, we like to highlight them here in our blog posts for anybody who is visiting our website. Next is Victim Services News, followed by a link where you can join our mailing list to receive our monthly TTA digest. And then last, over here on the bottom left, is an area where you can request training and technical assistance. So at this time, we are primarily providing training and technical assistance through our Project Safe Neighborhoods program. The Complex Homicide Project, unfortunately, is going to be ending here in September, but this website and all the resources we're going to talk to you about today will be available beyond that time. So TTA, our ability to fulfill TTA requests at this time may be a little bit limited. However, we will definitely respond to any and all requests. And if it's not something we can directly provide assistance on, we will definitely point you to an organization who may be able to do that, or at least some resources on that topic. And like I said, we do hope to expand our TTA offerings in the future. So next, I'll take you to our resources page. On this page, we have some resources on other National Center projects. Here are just some of those. And then down further are our complex homicide resources. Most of these resources were created by project partners, and specifically under outreach materials, almost all of those were created, and actually almost all of them were created by our demonstration sites. So huge shout out to them for doing a ton of work and providing and creating lots of resources that can be utilized by people around the country who are responding to homicides, or those who might be interested in building or expanding their multidisciplinary response efforts. There's lots of amazing resources here, and I'm going to turn it over to Sway to highlight some of them.
Great, thank you, Laura, for the introduction on the website. So as Laura mentioned, we're on the Outreach Materials tab. This is where you'll find materials created by the 7 demonstration sites throughout this project that can be helpful when working with victims of homicide. Please note that these are being shared to help the victim services field and are intended to be used in a way for other victim services agencies to create similar models. We want to quickly highlight some of the materials that were created from some of the sites. So first, we're going to start with the with the Anti-Violence Partnership of Philadelphia, who Complex Homicide Case was intrafamilial homicide. And we're going to touch on the intrafamilial survivor survey material. So AVP conducted a survivor research study for victims of intrafamilial homicide. They want to better understand the experience families went through after losing a loved one to enhance their responses to future families that may experience the same type of loss. This packet has documents that were used during their research study. It has stuff as an outreach letter, a consent form, and follow-up interview questions. Of course, with conducting research studies with survivors of homicide or any survivors, it can be challenging as wanting to ensure that you're being victim-centered and trauma-informed and giving survivors adequate time to grieve. However, when surveys are conducted years later, it can be difficult to reconnect with survivors if they haven't gone or sought services in a while. A great thing that came out of this, what we realized with AVP, was when they did follow up with survivors from years before, they were able to connect them with services years later that they did not need, that they were able to access. So it was a good turnout. They did receive a lot of good feedback information about that, and more information will come out later about their results on this survey. Next, we want to go to the Baltimore Child Abuse Center tab, and they did child witness to homicide, and briefly talk about their child survivor of homicide primary needs assessment. The Baltimore Child Abuse Center created a child survivor of homicide primary needs assessment to determine the immediate needs a family will need after being impacted by a homicide, and is referred to their center. The advocate or case manager will then follow up with the family for ongoing support and seeing what their needs are immediately. And shout out to the Baltimore Child Abuse Center as well. Next, we're going to go to the Bronx District Attorney's Office in New York. They did gang-related homicide. And we want to briefly touch on one of their agendas, which is the Restorative Retelling Group agenda. This is an agenda that they use for their group therapy. One thing about restorative retelling is that it is a structured group intervention developed to improve coping skills, integrate commemoration of the deceased, and approach traumatic memories. The Bronx DA shared their agenda of one of their group therapies and what they went over during the discussion. During the pandemic, we realized that support groups like this can be done remotely, and sometimes victims prefer this as this is a safer and more accessible way for them to attend their group session. And as you can see but in detail they went over that during those sessions, what day they were. So this is a good model to follow, and if you have questions about it, feel free to reach out to the Bronx DA, and you'll later be able to see their contact information as well. Next, we want to go to the Chicago survivors, which also dealt with gang-related homicides. And we're going to highlight one of their brochures, which is called Your Rights in Funeral Planning. This brochure is to inform survivors of homicide on their rights of planning a funeral. In Chicago, some funerals were taking advantage of families who were impacted by homicide before knowing if they qualify for crime victim compensation. As we all know, with crime victim compensation, it can vary from state to state. And since it's a lot of gang homicides occurring in Chicago, if the victim was related in a crime during the homicide, then they won't be eligible for crime victim compensation, unfortunately. However, funeral homes would take advantage of families about this and would get them to make payments without knowing they will receive money from crime victim compensation. So this gives a background on how funeral homes were taking advantage of victims and what the rights are for families when going to funeral homes. Next, we want to go to Frontline Service, which is in Cleveland, Ohio, who also dealt with child witness to homicide. And we want to review there, how do I answer the child's questions about death? They created this to information on how to talk to a child about death and what are some best practices when doing so. It explains on how to share the information with the child and how to respond to follow-up questions and a child may ask after explaining the death to them. This material can be helpful when speaking about families that have strong religious beliefs. It provides guidance on how to navigate that as a service provider and maybe as someone with a different belief system on how to respond to children who may have these questions. From this site, we also created a webinar which is called Spiritual Sensitivity in Homicide Cases, and which we'll see later on the resource page. And we talked about on that webinar on how to respond to children who have these religious beliefs and what to say to them as an advocate. Next, we'll go to the Medical University of South Carolina and touch on their manual on implementing comprehensive services for survivors of intrafamilial homicide. The Medical University of South Carolina created this manual for agencies that provide services to families that have lost a loved one to homicide. Specifically, the guide provides implementation strategies of a comprehensive services model for those that are impacted by intrafamilial loss. It also showcases Charleston Heart as a model, providing a practical roadmap for communities seeking to establish a multidisciplinary response for grieving families. This packet includes some confidentiality agreements, MOUs, and other models that can be used in the victim services field. And we also want to touch on another thing from MUSC, and that's their Coastal Crisis Chaplaincy. This is a volunteer application that they use for Coastal Crisis Chaplaincy at their MDT. And we want to highlight their Coastal Crisis Chaplaincy as they have been an integral part of their multidisciplinary team, and they have attended their grantee meetings and all of the trainings that were provided to them. And this is a great crisis chaplaincy that MUSC has in Charleston, South Carolina. And next, we will go to the West Palm Beach section and touch on their Survivor Resource Packet. West Palm Beach created a Survivor Resource Packet for families who lost a loved one due to a driving-related death. It is given to a family following immediately after the death notification. As we all know, following a death notification may be hard for the family to retain information provided to them by law enforcement or an advocate. This packet has information about the law enforcement agency on the case, along with their badge number and their contact information. It will also have the contact information about the responding victim advocate, so that family can contact them the next day if they have follow-up questions. As you can see, here's the part of the packet that will be provided to the family. And we also want to highlight a similar package that's also on the website for those that are impacted by crashes involving a seriously bodily injured. And then we want to highlight their death notification card. As we know, death notification may be hard for law enforcement. And one thing we also want to shout out is the Palm Beach County Sheriff's Office, as they receive training from us on death notification every year under this project, along with vicarious trauma. Some of the officers had training at some point of death notification, but they appreciated the refresher course. And this Palm card is given to law enforcement officers so they can review to see what some best practices in providing a death notification and how to be victim-centered. And shout out to Palm Beach County Sheriff's Office as well.
Wait, do we still have you? Looks like he dropped off, but actually it's pretty good timing because I was just about to switch. Oh, now we can hear you.
I don't know why I went on mute. I didn't touch anything. Sorry, everyone. What was the last thing you said? I said?
The shout out to Palm Beach. So we were just getting to the one additional material.
Sorry about that, everyone. I must have dropped out. Yeah, so the additional materials page is most of these materials were provided by the National Sheriff's Association. One of the materials is DUI crashes, real crime, real victims, which is a roll call video that addresses the response and for law enforcement to interact with DUI crash victims in a victim-centered way. And we also have at the bottom a book list of child survivors of homicide that is useful to provide for children who deal with homicide or death. This resource was created with partner from the Wint Center for Loss and Hearing, along with West Palm Beach Services as well. And now I'll pass it over to Laura.
All right, awesome. Thanks so much, Sway. So I'm going to transition from our outreach materials to the next tab down on our resource page, which is presentations. So here in the presentation page, we highlight all the presentations that were done in person throughout this project period. For most, as you can see, we have presenter headshots at the left. We also have, there's a link on their names that will pull up a bio if you click here. Their bios have information about their background. Some of them also do have contact information. If that was something that they wanted to share with the general public, you might see their emails or phone numbers or things like that. So if you have specific questions about trainings, you can not only reach out to us, but also reach out to the individual presenters if they've provided that contact information. And then over here on the right, we've got short descriptions of each of the presentations to give you a bit of an overview. And again, if it was something we could share with the public, we've got PowerPoints that will give you a better in-depth idea of what we talked about, and then other materials that were used by presenters during the presentations. Next is our webinar page. So very, very similar to the presentation page, except these were all trainings that we did online. See me there over there on the left. It's the same sort of setup. We've got presenters on the left, links to their bios, information about the presentations. The only difference is on this page, we do have recordings of the webinars where they are available. We're working on uploading all the presentations to our YouTube channel, where you'll be able to go and watch the presentations in their entirety. I think Sway mentioned, so when we were talking about the frontline resources for working with child victims and dealing with religious beliefs, we put together Spiritual Sensitivity in Homicide Cases webinar, where we had great presenters talk about a lot of different types of spirituality and how you navigate that as a service provider, dealing with the survivors' religious beliefs, and then also your own, and how to talk to victims in these cases about spirituality. So lots of great webinars here. Like I said, we will have links to most of them up here probably in the next month or so. Then next, we will go back to our resources page and click on program evaluation. On our program evaluation page, oh, there it goes. It's like, it's not coming up. So you'll see another, I think we call it a light page come up. The first resource we have here is, well, not exactly a resource, but rather it's an evaluation of the work we've done on this project that was completed by our partners at the Urban Institute. I was really excited to be able to post it. We just finalized it. I'm very, very grateful to the Urban Institute for their help with this. This was something we had asked them to do within the last year, and it's something they were able to do pretty quickly and on a pretty tight budget, and we are so appreciative and happy about how it turned out. Next, we have an OVC resource on conducting a needs assessment, and then we also have a resource about needs assessments and training outcome evaluation in urban areas linked here. We are going to then go to our safety planning page. On the safety planning page, you'll see, it will pop up here in a second. There we go. We've got a safety plan for threats and intimidation that was developed by Chicago survivors. So as I mentioned, the Chicago survivors dealt with lots of gang-related homicides. And there are many, many safety plans out there, lots for victims of domestic violence, and you can easily find them online. But the interesting thing about Chicago survivors is that theirs was specific to working with victims who are at a higher risk for threats or intimidation, which is more common in gang-related homicide cases. So if you're looking for a safety plan that has more specific information about victim witness, intimidation, retaliation, and how to keep those victims safe, this is a great resource. Chicago survivors also put together this record for safety planning, which is something that can be printed and given to victims so that they can document any sort of threats or intimidation that they're experiencing. And this will be helpful if they're trying to seek assistance from any sort of criminal justice agency. It's good to have it's always really good to have a record of instances and information that you can share with professionals who are trying to provide assistance. And then the last resource on this page is Privacy and Dignity Guide. So the National Center created this guide to interacting with the media years ago. It needed updated as there's been many, many changes since it first came out. And it focuses on privacy and dignity. So we created it because we get a lot of questions about the media portrayal of crime victims and their families, and it's something that the demonstration sites encountered on the project as well. There are definitely challenges of how to help survivors navigate media attention after a traumatic homicide has occurred. So in this document, we do focus on privacy and dignity. Privacy emphasizes the need to protect victims from exploitation and additional trauma by providing basic information about the potential risks and benefits of interaction with the media. And it also emphasizes that victims need to understand their rights, including their right to privacy. And then on the other side, dignity for crime survivors varies by individuals and circumstances. But we wanted to emphasize the critical need for advocates to empower victims to make their own informed choices that were best for them, particularly when they're interacting with media and social media. So we divided this guide into 3 separate sections. First, for victims. So like I noted, a lot of victims, if you're a surviving family member of a homicide victim, there is often media attention, sometimes a lot of media attention. So survivors are navigating this really difficult period post-traumatic homicide event, and then sometimes they're having to deal with lots of media attention that they've never had to deal with before. And so we created this information for victims at the beginning of the guide to help them figure out how to navigate the media coverage. And we also wanted to make sure they know their rights so that they were informed of what options are available to them, what they can do, what they maybe shouldn't do, and think about how it might impact any sort of ongoing civil or criminal case that is related to the case. The second section here is for advocates. So in this section, we highlight some policies and procedures that are recommended, for instance, in regard to protecting victims' confidentiality and privacy, how to handle media requests if the media is making a direct request to an agency helping the victim rather than the victim themselves. And then, of course, we focus on supporting crime victims, empowering them to make informed decisions about how to work with the media. And then the last section is for journalists. So there's definitely a need for victim-centered and trauma-informed reporting. There's a lot of interest in true crime lately, and some producers do it really well and focus on the victims, and others not so much. And it's more of a perpetrator focus, and they may post things or images or things that maybe shouldn't be shown to the general public. So we've included this section where we emphasize focusing on victims, not perpetrators, and then also definitely considering impacts on any sort of criminal or civil case that reporting might have. All right, so that is our safety planning section, and we will next move to our section on evidence-based practices. So this section includes evidence-based practices that were identified and then also utilized throughout this project period. The first one here is something we just finalized. It's a deliverable for the project that highlights promising practices for responding to complex homicide cases. The majority of the publication focuses on improving multidisciplinary responses to families and communities in complex homicide cases. We did include, I'm going to scroll down the table of contents. I think that gives you guys the best idea of what's in these documents. We did include a section on building a multidisciplinary team, as there may be individuals, agencies, organizations, or other entities that may not yet have a coordinated response in homicide cases, but might be interested in forming one. So in this section, we list a number of agencies that may be included when creating a multidisciplinary response. When dealing with homicide, so many aspects of survivors' lives might be affected. So of course, you're going to include law enforcement, victim advocates, medical examiners, and representatives like that in a multidisciplinary response. But there are definitely also organizations and agencies that you might not think of right away when you're thinking of, response to crime victims and survivors. For instance, Sway noted MUSC's partnership with the Coastal Crisis Chaplaincy. So religious organizations are a big one, especially when dealing with homicide, because death and spirituality can be so interconnected. You definitely want to consider including religious or representatives from religious organizations in your multidisciplinary team. In addition, depending on the types of victims you're working with, are organizations that focus on child witnesses to homicide. A lot of them partnered with schools and representatives from schools, as those homicides that kids would have witnessed are definitely going to affect them in school. And then those in the medical field. So a lot of victims of homicide, when we think of death notification, like Swain talked about a little earlier, we're a lot of times thinking this is law enforcement going and doing a death notification at somebody's home. Somebody passes away after being brought to the hospital, it might fall on the medical professionals to provide those death notifications. And it can also be helpful to inform medical professionals about what services are available to victims. So if they are talking with a family of a homicide victim, that they can provide them with a little bit of resources and guidance, just as law enforcement might do during a death notification. We also included a number of services that victims might need, and then also training that advocates and others working with homicide victims should receive. As Sway noted, we received so many requests for death notification training. I think we did them at most sites, sometimes multiple years. We also put together a webinar that was in part on death notification. It is available online. The death notification is so important because it's often the first contact with survivors, and that can make a huge impact on how they view the justice system moving forward. There's a section on challenges here where we talk about how to address some challenges that the sites encountered. You can see the survivors in the media section that, of course, took information from the Privacy and Dignity Guide and links to that guide. We also discussed vicarious trauma when dealing with victims of homicide. Vicarious trauma is definitely something that a lot of service providers are going to experience, and so we emphasize the need for training on that and self-care. We talk about surveying survivors, like Sway was talking about the Anti-Violence Partnership Survey and some challenges associated with that, how to kind of make sure you are doing victim-centered trauma-informed surveys while giving people enough time to grieve, but not waiting so long that they have maybe moved or you might be unable to contact them. Many of these topics in the challenges section were things that a few of the sites encountered. Others, like gang violence, focus on specific challenges related to serving those populations. And that's a little bit of info about the privacy or the Promising Practices Guide. And I will now take you back to our resource page and want to just briefly mention a couple articles. We gathered articles, academic articles online that were relevant to homicide. And I definitely want to highlight this first one, which was published by my colleague Gail Tom on homicide in Indian country. So when we were creating the website, we wanted to list resources that were comprehensive. And though we didn't have sites focused on homicides in tribal communities, we want to ensure that our resources were as inclusive as possible. So I was thrilled when Gail sent me this article that she'd written years ago that addresses responding to homicides in tribal communities. And for our last category, grantee meetings, I will turn it back to Sway.
Thank you, Laura, for all that information and just making sure you can hear me.
Yeah, loud and clear.
Great. So grantee meetings, I do want to give a huge shout out to all of our 7 sites who attended it. We had grantee meetings every year for the year 2017, 2018, and 2019. The reason for the grantee meetings is we brought a few members from all the 7 sites and their multidisciplinary team to collaborate and meet in person. We trained the sites on certain topics and also had the opportunity to collaborate with each other and talk about resources that they can share with each other to improve their response to homicides in their city. The documents you will see are the agendas for each grantee meeting, along with the presentations by the site in regards to their site deliverables and strategies created to improve their responses to homicides. I want to give a shout out to everyone who did attend our grantee meeting, from law enforcement to advocates to therapists, and to everyone from the sites that we are in direct contact with. And next, we're going to go to our directory page. In our directory page, you will find the contact information of the site, point of contact, along with their project abstract to talk a little bit briefly about their program. You will have to scroll down to the PSN stuff first, and then you will go to Complex Homicide contact information. Yeah, right here. And you will just click on one of the complexity of homicides, and then you will see the information, the contact information of the person at that site. We do want to note that things may change as far as in leadership at the site, so we will do our best to keep it updated. But as of now, it should be as updated as it should be as far as contact information. If you have any questions about any of the resources page, you're more than happy to reach out to anyone on that contact information. And then we want to give one huge shout out to everyone from the sites. Again, I see that some of you all are on, from AVP to West Palm Beach, MUSC, from the Bronx, VA. I want to give you all huge shout out and thank you for helping out with this project, along with our OVC grant monitors, Mary and Kareem. Thank you for helping us as well. And that is when it comes to the website. And now we have a portion for questions and answers. I know one question that was mentioned earlier, and I'll bring it back up, is where can you find these resources? The website is ncvctta.org. Someone asked, how can you download the resources? You can go directly to the website, click on the resources, and just download it like a simple file as well. Anyone else have any questions? Please type them in the Q&A box. We'll give a couple minutes for people to type out any questions they may have.
And any of you all that worked with the sites that we worked with, if you guys are on and want to mention anything that we might have missed or highlight anything, feel free to type in the chat or the Q&A.
And while people may be typing questions, Laura can go to the next slide real quick. The National Center for Victim Crime has their yearly conference, which is the National Training Institute. This year, we are officially going virtual from November 11th to the 13th. Anyone who registers by 11:59 p.m. by August 26th will receive a $25 discount using the coupon code FLASHSALE. So make sure you get note of that right now. The coupon code is FLASHSALE. If you want to get the $25 discount for the National Training Institute. And now we got a couple of questions coming in. So I'll start with the Q&A box. Is there a site in California? No, there was no site in California.
There are, so the sites we worked with weren't all organizations that have multidisciplinary responses to homicide. These are just the seven grantee sites. So there most likely are other organizations that provide these sort of services that we just didn't work with on this project.
Thank you. What type of agency typically coordinated the response team? So we've had victim services agencies We've had a DA office as well in the Bronx District Attorney's office, so it can vary. It just depends on the collaboration of everyone pitching in to address the complex homicide needs. Laura, did you want to answer that question?
I think you covered it.
Oh, okay. Question from Kara. How have people overcome challenges with working across agencies? Any tips for how to collaborate effectively? You'll always have challenges. One thing we did realize on this project is having that buy-in from law enforcement or other agencies. Some agencies want to be the lead on the response, or want to be the first contact. So you're always going to have that challenge. It's just being able to be transparent with each other and find out that this is the best for the victim and not the organization itself, but you also want to improve your response. So remember to always make sure that your main goal is to service the victim and not have issues between other agencies. So it's always a come to the mind meeting where everyone comes together and just talk and see how you can better your response.
Kara, that's a really good question. It's definitely something that a couple of sites, if not all, had some challenges with. I think, and something I have in the Promising Practices report was to kind of talk about, let's see, well, actually, I'm going to start with, I think a lot of sites did kind of a map. They mapped out what services were provided and who provided them. And that kind of helped delineate roles. And I think that sometimes can be a big obstacle because, trying to figure out who is exactly doing what and making sure there's not a huge overlap in that, and then also making sure there's not gaps in the response is really, really important. And I think once those roles are delineated a bit and we can, you're able to talk and discuss how you coordinate responses instead of providing any sort of like overlapping services, I think that was something that was helpful. There are definitely, other methods in overcoming challenges, and they'll be specific to, the organizations and the people working there and the politics behind those sorts of things. But if you have any specific questions or feel free to send us an email. I'd be happy to talk more with you about that challenge of working collaboratively.
Awesome. Next question from Kathy. Do you recommend still having a chaplain come along to do death notification when an advocate is present with law enforcement? My experience is that they only keep in contact for a short time. If advocates are trained, they can perform death notifications and still provide services through the criminal process. Again, it all depends on your site and how you collaboratively work. We've seen that at the MUSC site. Like I said, their chaplain agency, it works well with the multidisciplinary response. So I can't answer that in great detail as far as I'm concerned, but it depends on how you all collaboratively work together. Next question, are any of these resources restrictive to the area or state we're working at? Can't give you the detailed answer. Laura, would you like to answer that question?
Sure. Yeah, I don't think so. We tried to make the resources applicable to like nationwide, worldwide, to anywhere. Of course, the resources that the sites created are going to be more specific to their organization, their multidisciplinary team, and the communities that they're serving. So you might find that not everything translates exactly, but what we hope is that the information, the resources can at least be a model. So it might not be exactly the same. I wouldn't call it restrictive, but it might not translate exactly into your community or the victims you are serving. It might need to be amended a little bit.
So everyone that's on, I see that there are questions in the Q&A and the chat box. We're gonna go over the Q&A ones first and then the chat, but we would prefer that they come on the Q&A section. Thank you. Next is Tim. Wait, no. Okay,
Sorry, I was marking them off as we're going through, and I'm probably messing you up. Barbara asked, are the resource materials copyrighted, or can we reproduce with our contact info? These are things that you can take and make them your own. If you are using anything that was produced by somebody else, we just ask that you give credit to the organization that put together the resource, whether you note somewhere that this was adopted from this organization or this person or this site. That would be helpful.
Tim asks, any resources addressing the concern of interacting with victim survivors who may be part of the ongoing legal process? Excuse me. Trying to think. Do we have any on the website?
There definitely are. So I think the MUSC documents they do talk about, and I think you're getting at a little bit about like confidentiality and making sure that information you're sharing with partners is not going to come back and have any negative impact on an ongoing criminal or civil case. And so there are sample confidentiality agreements that may help with that. Let's see, I can't think of anything else specific, but if that wasn't what you were getting at, Tim, let us know and I'll try to give you a better answer.
Christine asks, is there a program in California which has produced similar data to the National Center for Victims of Crime and or similar documentation as the Chicago survivors for threats within the California laws? We haven't specifically worked with the organization in California, so we wouldn't be able to have that data for you.
Yeah, unfortunately, I don't know about specifically anything that's going on in California, but I assume information is out there.
Alice wrote, many of us have been using, oh, sorry, Alice, I think I answered that. We'll go over the questions in the chat box as well. We're doing Q&A first. Mary asks, hey, Mary, did the overall evaluation of any of the site evaluations have any findings related to whether or not there was much impact change for the family when the service provider was able to reach out to the family within 72 hours of the first week or so after the death? Just wondering if it seems to make a difference for families. I would say some of the sites did do an evaluation, and I believe they're still finalizing it for the project. But from what I've gained from chatting with the sites, it has improved for some of the sites. So I don't want to say yes or no and give a wrong answer, but that is my answer. Laura, would you like to touch on that?
Sure, yeah, so we are, that's one thing we haven't gotten to just yet is looking at the site's evaluations and potentially adding them to the site. I reviewed, I think, all of the reports that sites had been, all of the reports that they had to upload for compliance with the grant requirements. And there were at least a few that documented some when they did survivor surveys and talked with survivors in the community that indicated that there was an impact when the outreach was within that 72-hour period or even sooner in some cases. And I know that it often made a big difference in how well connected they were to services. So I think when you did that initial contact and had the protocol in place where law enforcement who were at a scene either contacted a victim services agency or provided information for the victim so that they could contact somebody, if that contact was made soon, it definitely improved services moving forward and how that person interacted with the system.
Great, thank you. Now I'm going to the chat box. Hopefully I do not miss anything. Someone said, how can I access the resources to review later? First, the webinar will be sent out to everyone. The link to the webinar along with the PDF slides and a brief survey. You can visit the website ncbctta.org and go to the resource page, and you can click on any document and download it onto your computer. We will not have a certificate. Can we send a certificate of attendance, Laura?
Yeah, we can create a survey. So everyone's going to get an email afterward with the PowerPoint, a link to the recording, and a survey that we'd love you to fill out. the surveys really help us determine what we're doing well and what we should improve on in the future. We can, I don't want to link, or I don't want to attach all the documents because then it's going to be a pretty weighty email. So we will definitely list the website so that you guys can go back to the website and explore it a little bit on your own. Like Sway said, you can download those resources. I think we can include a certificate of attendance. That shouldn't be a problem.
Great. And I think that was majority of the questions in the chat box. Someone said,
there was
repeat
one. Yeah, go ahead.
I'm going back to the Q&A. It says, can you repeat where we can find handouts for officers to give to families at the death notification? So that would be under the outreach materials for West Palm Beach. And you'll see it's a palm card. That's where you can find that material specifically. Go ahead, Laura.
Sorry to interrupt. There was one in the chat. I'm trying to find it. Can you share experience with developmentally delayed adults and death notification resources? So unfortunately, that's not something that came up when in the past 4 years when we were working with the sites, but it's definitely an area, there's working with special populations. We don't have a lot of material specific to that for this project. We do have a great resource is the National Resource Center on Reaching Victims. I think I'm saying that correctly. It's a project that we've been involved with for a while. They have a lot of really great resources for working with special populations, whether it be people with sight issues, hearing issues, developmental disabilities, or the like. And so we should definitely include a link to some of their resources somewhere on our website, and we will do that. So I'm sorry we don't have any of that specific information as it might apply to death notifications or homicide cases, but we do have programs that work with those populations a bit more and have some resources.
Awesome. Well, I believe that's all the questions I see. I don't think I've missed any. As you can see on this slide, here is Laura and I contact information. If you have any questions following up from this presentation, please email us or call us as well. And we can try to answer them as much as possible. So thank you all for attending. Thank you all to the 7 sites. Thank you to OVC, and thank you to NSA and the Urban Institute for all the assistance on this project. If you have any subject matter experts on this project online too, thank you all for your assistance in providing training to the site. And thank you all, and hope you all are staying safe and staying inside and are doing well. Thank you.
Thanks for attending and for all the great questions. We really appreciate it.